So the social aspect of diseases, the way people understand diseases is shaped. That understanding of diseases is shaped by social, cultural, and economic factors. Okay, someone can have TB, and then for them they will not think about the fact that this TB is actually caused by Mycobacterium tuberculosis. They will not think about the fact that this TB is caused by a bacteria. They will think they are bewitched, and the society might actually be understanding that a person who is having TB is actually a person who's either cursed or they are just basically bewitched. Okay, so social, cultural, and economic contexts actually influence what people understand as disease, and this therefore means that therefore this context actually influence whether they will therefore go and seek for medical help or they will go to alternative um, medical care, alternative care or alternative medicine options. Okay, now if you understand the social aspects related to particular diseases, then it means that you can have positive interactions with your patients, and therefore you can have very good opportunities to do health education and pass the right health messages. So that is good, right? That also, if you understand the social cultural dimensions of particular diseases, it becomes very easy for you to lobby for funding to initiate programs that can handle certain conditions. Basically, the point here is that if you don't take into consideration the cultural, social, and behavioral aspects of how people understand some diseases, it is going to be very difficult for you to implement health programs that can prevent diseases and even promote health. So it is very important, and actually understanding social behavioral aspects is very important in public health. The challenge is that there will always be clashes where you have biomedical understanding of what a particular condition is and the social cultural understanding of what a particular condition is. Okay, so you can have people who, using the biomedical lenses, are healthy, but using the social cultural lenses, they are sick. So you have that problem. They will look at themselves as sick, yet medically you think they are okay. Okay, so this often results into medicalization. That some over medicalization, you have normal human states that are unnecessarily getting medical interventions. Okay, so the other issue also is an issue to do with stigma and job denial. You have some individuals who have particular conditions and they have been denied opportunities to work in organizations because of their state of health. Yet, in our biomedical understanding of health, they can actually be able to work if they have particular conditions. So that is the influence of social cultural aspects. So the sick role theory So this one explains um, how society manages illness as a form of temporary deviance from normal social roles. Okay, in our earlier slides, we looked at the fact that if someone is actually sick, they may not be able to perform the roles that they have been performing. Okay, so the implication here is that when our understanding, the biomedical approach, which is very common, which we actually apply in most of our um, healthcare, we attribute conditions to biological or physiological malfunction. And then we forget that actually people come to our health facilities as social entities that are performing certain roles and responsibilities and have some rights. Okay? And therefore, when we understand this dimension, this social, this human being who has come to our health facilities as a social entity who is coming from a social system and having particular roles and responsibilities, we can perhaps be able to handle them quite well, such that they can continue to fulfill their normal social roles, whether it relates to family, work, and other aspects. Okay, so when people become sick, um, our societies, the people that we live with, uh, can excuse them from performing some of these roles until they actually recover. And then another social aspect that influences the interaction of patients with health professionals is the issue of medical institutions and the decisions that are made in these medical institutions or health facilities. Society accepts the role of health workers in that they don't question what the health worker actually suggests. This is basically to say that the voice of the health workers is actually uh, just taken in, or the decisions that are made by the health workers are taken in, are accepted because the health workers are viewed as people who have authority because of their training, expertise, and the power of these institutions or health facilities. So generally, um, health facilities or health institutions are viewed as institutions that have that authority, and the societies do not question this, because in a way they have accepted the fact that these institutions hold authority because of training and knowledge. So therefore, patients are generally expected to cooperate and comply with medical instructions because that is what the society generally accepts. The other point is that our understanding of medical conditions is actually expanding. There are things that initially were not looked at as medical conditions, but with the time they are now being recognized as diseases. For example, um, what you can term as antisocial behavior, deviant behavior, um, is is now recognized that that actually is a medical condition that can be handled. Okay, Initially, these are things that can be looked at as moral failings, that individuals fail to conform to certain societal norms. They behave in antisocial way. Okay? But now we are recognizing that that behavior is actually a medical condition and can be handled medically. Okay? So this again is to emphasize that uh, there is a, there is a shift in how some of the conditions are viewed at societal level to uh, the aspect of medicalizing some of these conditions, and deviant behavior is basically one of those. Okay, and thus um, this basically brings in the aspect of the other dimension um, of moral aspect of health. Okay, when we talk about the dimensions or aspects of health, majorly you will hear people talking about physical health, psychological health, social well-being. But we are also emphasizing that we have a moral aspect to health. And if you expand again the other aspects, uh, emotional health, spiritual health, and many other dimensions that I've not mentioned. So the sphere of influence of uh, our understanding of health conditions is actually expanding.